maybe two things that we could go down, but maybe the first one around administrative work, because I actually, quite honestly, I don't know what that looks like. So maybe you can walk us through potentially a case of with like what is that additional the added sort of administrative burden, because I actually just recently listened to a podcast on Freakonomics, and they actually call this sludge, right? I guess
Mm,
like work that
yeah.
doesn't really necessarily need to be done, but it's like there for some reason, right? And the kind of the best example they talk about is this door, the door that has a handle where you're supposed to like push, but you pull
Oh,
for
the
some
Norman
stupid reason.
door.
Yes, a Norman door.
Yeah,
Exactly. So they call
yeah.
that like sludge, like things that shouldn't really exist that give you extra work. So maybe you can go through what is this administrative sludge that you have to go through as a doctor. If I come to see you as a patient, what does that look like?
Yeah. Well, and so not all paperwork is, unnecessary administrative burden. We know some element of paperwork is required because we need to keep records. That just is. You have to be able to record what happened during a patient visit so that the next time you see them, you know what happened last time. We're not going to memorize people's health. And when we go between providers, they need to be able to share that information. So writing a consult letter, for example, that is something that has to be done. Now, maybe there's ways we could do it with AI, or not even AI, with scribes that are real people, or AI scribes. There may be other solutions, but that communication still is going to have to happen. Where we get particularly frustrated is the type of paperwork where it's like disability forms. And now somebody's qualified already provincially to get disability assistance at the provincial level, but the feds have a completely different form that requires totally different paperwork. It's, 30 pages that you're filling out, and you're assessing things that you're like, I don't know. Can you carry a laundry basket up the stairs? I've never seen you carry a laundry basket up the stairs. Like information that the physician also doesn't even feel like they can really do. So pages and pages of filling out forms that the person's already done for a different program on the same topic. This is where people get really frustrated. Or sick notes. When someone's had a cold or a migraine and their employers require them to come in, and they come in usually days later when they're feeling better. And so I'm sitting there just filling out a thing saying like, they told me they had a headache. I don't like I can't prove that they had a headache. And so now I'm doing this paperwork, and I've had it where the employer didn't like the way I wrote it. So then they come back and I have to rewrite it. And those are the types of really frustrating circumstances. And then there's just simple things like you have to put all the identifiers on every lab requisition. So you're filling out, and I've had lab samples sent back because they didn't have like 3 unique identifiers. And sometimes people are using their Indian status card, and then some labs don't like the status card as an identifier. And so they send it back because they want to see their provincial health number and their date of birth. And you chose the wrong ones, or you took the wrong, different labs will give you different forms to fill out. And so you accidentally filled out for lab A, but the person who didn't know that went to lab B and they won't accept it.
Mhm.
So these are the types of very frustrating circumstances where you're repeatedly doing work that doesn't feel like it's contributing to the health of your patient in any way. And that's the kind of stuff that we really need to have all levels of government work together to improve. Because, if the province has already approved somebody saying they have a disability, if they don't have a leg, it's not growing back. And yet, with the federal forms, every 5 years, you have to re up. And so it
Right.
doesn't matter if it's a permanent disability, you have to prove it again 5 years later. No, I still don't have a leg. So working together between levels of government to get rid of some of these forms would be really helpful. Having the labs use standardized processes for what requisitions work, bringing in AI scribe, because that can help us write our notes, write our consult letters. We still have to review them, but I think we all know that editing a document's a lot easier than doing one from scratch. So there are great solutions out there, but right now it kind of feels sometimes like you're in a hamster wheel, and people are just throwing random pieces of work at you while you're running in this wheel.
Wow. Honestly, it sounds like there actually is some low hanging fruit that can
Yeah.
do some good. It's just a willingness
a component that is in question more than anything else. So that's
Well, we've seen some
incredible.
positive steps. Like Nova Scotia had an administrative burden red tape reduction task force, and they did do some simple things like in their hospitals now, instead of having to log into every system, your badge just taps you into the computer system. I
Hmm.
mean, if you think about how many times a day am I logging in when I'm at the hospital, and even if each one takes 1 minute, if I'm doing it 60 times a day, 100 times a day, how many minutes am I spending? So they put in stuff like that where you just tap into the computer system and now you're ready to go. Uh, Ontario and I think it was Nova Scotia also came up with legislation that limits when employers can ask for sick notes. They're not gone, but you have to be out for at least 3 days or 5 days. They're all slightly different. So there's some good steps. We just need to keep going.